As we hold this hearing today, we must recognize the situation that we find ourselves in. We certainly respect the federal court's authority over prison care and recognize that achieving a constitutional level of care is a requirement as well as appropriate. We understand the receiver is carrying out his job to improve medical care in prisons to those constitutionally mandated levels. But we also understand that the receiver is spending state dollars, and the legislature has the right, indeed has the obligation, particularly at this time, to review every area where dollars are being spent. When the receivership was created, no one doubted that things were going to change in the state's prisons and that medical care costs were likely to rise. But we now see a dramatic growth in those costs during the past 5 years, at a time when the state budget could least afford those increases. Overall, health care costs grew by more than $1 billion annually between 2005-06 and 2008-09, a 100% increase in 3 years. And while there has been some decrease since then, we are still projected to spend more than $2 billion in fiscal year 11-12. Today we have questions about several areas under the receiver's purview: consultant salaries and expenses that appear to be out of line at a time when that's simply not appropriate, staffing levels that have more than doubled, and a headquarters staff that was described as oversized and unnecessary in one report. In fact, we have displayed a chart here that shows the continuing dramatic increase in staffing levels over time for the receiver and related work. We know also that our ratios of staffing are far different than most other states that we've looked at, where the staffing ratio is much higher in California than it is in other places. That is to say, there are many more staff per inmate in California than in other states across the country, states that have been in receivership but have in fact been released from that receivership. There was a commitment to an $800 million budget cut for the receiver in the current year, which the receiver has reported he is largely unable to accomplish. And finally, the receiver has entered into a significant contract for health care in our systems, which may, in fact, be a good contract, but we have no way of knowing, because we are precluded by law and by action of the receiver of knowing not just the details of the rates under that contract, but in fact, even the total amount. So the public, let alone the legislature, has no way of knowing what the amount of that contract is or what the rates are charged under that contract. These are the issues that we would like to explore this morning. So, with all this, nonetheless, with all this increase in spending, the increase in staffing, the rest, most troubling, our outcomes remain poor. In fact, a report from the Office of Inspector General determined that only 2 of 17 prisons met minimum standards for what's described as moderate adherence. So while we are spending dramatically more, we are not seeing a change in outcomes, and that's something I think we ought to all be very concerned about as well.